Which country is doing the best with coronavirus? Well, for the next few minutes or hour or so, I'm going to be talking all about coronavirus, and we're going to compare the countries, how to go at ranking each country based on various statistics. So I'll explain the method as we go. Okay, the country in 16th place is Brazil. And just for the record, I've chosen the most prominently talked about countries, except China, because the data from China is unreliable at best, and because this was originally going to be a video about leaders' approval ratings, and I couldn't find that data for China. So it became more detailed as things progressed, and lo and behold, I didn't include China, but it did include all the other most talked about prominent countries with regards to coronavirus. So, Brazil. So the cases before the lockdown were increasing at a rate of 15% per day. That means that each day, the new cases were increasing by 15% on the previous day. After lockdown, of course, Brazil didn't actually go into lockdown. That still remained at 15%. I looked at the week before the country went into lockdown and compared it to the last 7 days. The same goes for the cases per million population. It was the week before they went into lockdown and the last 7 days. And of course, Brazil did not go into lockdown, so they have not changed at all on that front. In the last 7 days, the cases in Brazil have been doubling every 7 days. And what I've done here is I've looked at the average rate and the average number of cases that countries went into lockdown according to my list. So if they deviate from that average, if it's too slow or if it's too fast, then I'll say. And if they deviate in terms of the number of cases, if there's more cases than average or if there's less cases than average, I'll say too many or too few. And what we can tell from this is if the rate of cases is too slow and the number of cases is too few, that means that the country went into lockdown too early, which can be a bad thing economically and keeping the public on side in terms of those reasons. If the rate of infection was too fast and the number of cases was too many, then that kind of proves that the timing of the lockdown was too late. And if it's kind of a different at odds with each other, so it's rising too fast or it's rising too slow, and the number of cases is too few or too many, depending, then it kind of proves that the timing was about right. And at the moment, Brazil, even though they've not gone into an official lockdown, the cases are increasing at a rate that's too slow, but they have too many cases compared to the average. So it might be time that Brazil should start thinking about going into a lockdown. As for deaths, well, they've not increased at all because they've not gone in a lockdown. But it's the same thing with cases. I took the week before the lockdown and the last 7 days. And the number of deaths in Brazil has been doubling every 5 days. With regards to the deviation from the average, it's the same as the cases. So once again, Brazil has too many deaths, but their rate of death is slower than average, which implies that their testing of coronavirus is poor. So let's have a look. Their mobility is down 43%, which is about middle of the pack in terms of this list. The approval rating of the president, 53%, because he's not gone into lockdown. It has slumped as a result of that. We don't know how many hospital beds there are per 100,000 people. We don't know how many ventilators there are per 100,000 people. And the test per million is 258. So overall, because we don't know the information about the hospital position, they're last. And testing-wise, they're 14th on this list. So overall, they get 16th place in our list. So let's find out who's going to be number 15. And it's Turkey. So Turkey has gone into lockdown. It went into lockdown on the 18th of March. That, by the way, the lockdown date I put down is the date that the country started to go into lockdown. So for example, in the USA, different states went into lockdown at different times. I've chosen the time from which the first state or the first territory went into lockdown, which is Puerto Rico, on the 15th of March. For Turkey, it's the 18th of March. The week before lockdown, cases were increasing at a rate of 22%. After lockdown, that slowed to just 21%, so not really a huge difference. Cases per million beforehand were 2.6 per million. After, there were 248. So a net slowdown of -1% and an increase of cases by 245.4 per million. So cases were doubling before lockdown every 5 days, and they're still doubling every 5 days. The lockdown itself, in terms of cases, the rate of increase was too slow compared to the average, and the number of cases was too few. So they actually went into lockdown early in terms of cases. The death rate before lockdown was 17%. That's increased to 26%. Deaths per million before was 0.02. Deaths per million after was 5. So that's a net increase in the rate of death by 9% and a net increase in the number of deaths by 4.98 per million. So before the lockdown, deaths were doubling every 6 days. Now they're doubling every 4 days. Again, in terms of lockdown timing, the rate of deaths was too slow at -11%, and the number of deaths was too few at 1.69, so they still went into lockdown too early. And the approval rating for President Erdogan is 41%. Mobility is down 45%. Again, that's middle of the pack. This is where they really do poorly. Hospital beds per 100,000, 2.81. Hospital ventilators per 100,000, 20.4. And tests per million, really poor, 1,680, which implies that the number of cases might be a lot higher, and so be it the number of deaths. So 6th overall in terms of their hospital position, and testing 11th overall, giving them the 15th spot. So who's number 14 on our list? I'm not going to tell you which countries are involved, just because it increases the suspense a bit and we can find out. Number 14 is India. Before the lockdown, India was increasing cases by 22%. Their lockdown was on the 24th of March. Now that's reduced down to just 20%. Cases before the lockdown per million were 0.4. Now that's increased to 2. Of course, India is a very high population country, so the cases per million is going to be a lot lower. So the net change in rate was down 2%, and the net increase in cases was up 1.6. So before the lockdown, cases were doubling once every 5 days, and they're still doubling once every 5 days. Again, the lockdown timing in terms of cases was too early. In terms of deaths, they've increased 1% from before to after, and in terms of cases, they've increased 0.05. Both before and after the lockdown, deaths in India were doubling once every 4 days. In terms of lockdown timing, in terms of deaths, again, it was too early, both in terms of rate and in terms of the number of deaths. But here we go. The testing position is 16th because they've only done 84 tests per million, probably because they've got such a huge population. And as we know in India, their hospitals aren't very good. So the hospital beds per 100,000, 0.53. Hospital ventilators per 100,000, unknown. And mobility is down 49%. So they are complying, but because of their hospital and testing capacity, they're doing pretty poorly on our hot list. So in 13th place is South Africa. So South Africa went on lockdown on the 23rd of March. Their cases before lockdown were increasing by 30%, and now they're slowed right down to just 4%. Cases per million before lockdown was 6.7, and now they're 25. So we've had a net slowdown of 26% in terms of cases, and a net increase of 18.3. So to put that in perspective, cases before lockdown were doubling at a rate of once every 3 days. Now they're doubling at a rate of once every 25 days. The deviation from the lockdown rate was just about right. In terms of the number of cases, it was too few, but in terms of the rate, it was too fast, which means that the lockdown timing in terms of cases was about right. As for deaths, well, there weren't any deaths before lockdown. That's increased at a rate of 49%, which is where this country is doing poorly. And it implies that the number of cases that they've actually tested and recorded is actually a lot fewer than the reality. So beforehand it was 0, and after it was 0.2 per million. So that's an increase of 49% and a change of 0.2. Deaths before lockdown weren't doubling at all because there weren't any. After lockdown, doubling once every 2 days. And the lockdown timing in terms of deaths was the rate was too slow and there were too few deaths. In terms of deaths, the timing of the lockdown was too early. So mobility is down 56%. The approval rating of Cyril is 62%. We don't know about their hospitals, so they rank low on our hospital position. And the test per million is pretty low as well, 849. So that implies that they're going to see a lot more deaths in the coming weeks, and we won't know whether or not those deaths are attributed to coronavirus because of their testing capacity. In 12th place is Mexico. So Mexico went into lockdown on the 2nd of April, so there's not been a lot of change in terms of cases. But in terms of their lockdown timing, they got it just about right, really. So the rate was too slow, but the number of cases was too many. So, give and take, they got it about right. In terms of deaths, well, deaths have actually decreased in rate, so decreased by a rate of 3%, and they've obviously increased 0.13 per million. So in other words, they were doubling before the lockdown once every 3 days, and that's now increased to once every 4 days. And once again, the rate of death was too fast before the lockdown, but the deviation of coronavirus cases, deaths, was too few, so they got it about right. The mobility is not down very far, it's only down 28%. Approval rating is pretty high for Andres Obrador, 60%. And the hospital position is pretty poor, 13th position. Hospital ventilators per 100,000, only 1.6. 100 beds per 100,000, only 1.3. And testing is pretty poor as well, at test per million at 122. So, in our 11th place is Japan. So Japan haven't actually gone into an official lockdown, which is why I can't record the net changes or the net cases changes. In terms of the timing, if they were to do it now, obviously they've slowed down massively in the number of cases per day. It's now only increasing at once every 25 days, so it would be silly to go into lockdown now. And the same goes for deaths. So as a result of mistrust, perhaps, the approval rating of Shinzo Abe is at 32%. Mobility isn't down very much at all, only down 17%. And Japan has the best hospitals in the world. So ventilators per 100,000, 25.8. Hospital beds, 13.05. Tests per million, 312. Again, not a huge amount of tests. That's really low on our lists, which, considering it's a first world country, you'd expect. So in terms of hospitals, Japan has done the best out of the world. But whether or not they're actually dealing with coronavirus or whether they're just ignoring it is debatable. So, in 10th place is the USA. So, before lockdown in the US, cases were increasing at a rate of 31%. After, that's reduced down to 15%. Cases per million before were 12. Now it's gone way up to 816. So the slowdown has slowed down by 16%, but cases have gone up by 804. Of course, the more cases you have, it doesn't matter if your rate of increase is low, it's still going to be a lot. So 15% of 816 people per million is a lot more than 31% of 12 people per million. So even though the rate goes down, it doesn't matter because you've still got a lot of cases. And I've ranked the countries based on how well they've reduced the rate of new cases and the number of cases. So to put that into perspective, the cases before the lockdown were doubling once every 3 days. After the lockdown, they were doubling once every 7 days. By the way, I included the 15th of March as the lockdown date. That's because Puerto Rico went into lockdown on the 15th of March, but California didn't go into lockdown until the 18th of March. I thought it'd be generous to each other country and go from the earliest possible date. That way, I'm not being unfair on countries that kind of more gradually went into lockdown. But even still, on the 15th of March, the rate of increase for the whole of the US was increasing too fast at 7%, and the number of cases was too many, 166.2. So ultimately, the US left it too late to go into any kind of lockdown. The death rate increase before lockdown was 18%. After lockdown, that was 22%. Deaths per million before was 0.21. After, that's 22. So that's an increase in death rate of 4% and an increase in deaths by 21.79 per million. In terms of timing, so deaths beforehand were doubling every 6 days. Now they're doubling every 4 days. Actually, in terms of deaths in the US, the 15th of March was too early to go into a lockdown. I've noticed that countries seem to concentrate more on cases when they decided to go into lockdown. And the thing that frustrates me is that the countries have seemed to go into lockdown more when their cases are high rather than when the rate of increase was high. Of course, cases make the headlines, but it's the rate of increase that really matters. Mobility is down 28%. That's not huge. Approval rating for Trump is 44%. That's the positive approval rating, by the way, not the overall approval rating, hence why approval ratings don't include minus numbers. Hospital beds per 100,000, 2.77. Ventilators per 100,000, 18.8. That puts them in 9th position overall. And tests per million, 4,097, which puts them 8th in terms of testing position. Obviously, the US is a bigger population, so getting tests out to people is much harder. So, in 9th spot is Spain, Pedro Sanchez. So they went into lockdown on the 14th of March. Before their lockdown, cases were increasing at a rate of a whopping 47% per day. Cases now are increasing at a rate of 9%. So before lockdown, the cases were 143.6 per million. Now they're 2,518 per million. So they've slowed the rate of cases down by 38%, and the number of cases has increased by 2,374.4 per million. To put that in perspective, so cases before the lockdown were doubling once every 2 days. Now they're doubling once every 11 days, and they kind of got the timing in terms of cases of the lockdown about right. So the rate of increase was too fast, but the number of cases compared to the average was too few. And that's probably because on our list we've included countries that might have a lot more cases that were kind of surprised by coronavirus. In terms of deaths, so the death rate before the lockdown was 51%, that's huge, and the death rate after lockdown was 11%. Deaths per million before was 4.39, and after that's increased by 251. So the net change, the net slowdown in deaths has gone down by 40%, and it's increased overall by 246.61 per million. The deaths doubling before the lockdown was once every 2 days. Now it's once every 9 days. But if you look at the timing of the lockdown, the rate was too fast and the number of lockdown deaths was too many. And that ultimately meant that the lockdown itself, in terms of deaths, was too late. And that probably means that the number of cases recorded was fewer than the reality. And the approval rating of Pedro Sanchez is 40%. Mobility has gone down massively, minus 65%, as it has throughout Europe, actually. Hospital beds per 100,000, 2.97. We don't know the number of ventilators. Tests per million, about average, 7,593. So not great on terms of the hospital side of things, about average in terms of testing position. So, in 8th place is the UK. Now this makes me kind of sad as somebody from the UK, because at the one point the UK was top of my list, and I'll get onto why as we go through. But before lockdown, the number of cases were increasing at a rate of 23%. Lockdown was on the 23rd of March. After, they were increasing at a rate of 15%. So the UK kind of went into a more gradual lockdown. They said people who with symptoms must isolate for 7 days, And then a week later, they said people with symptoms or people who know symptoms must isolate for 14 days. And then a few days later, they said avoid restaurants, clubs, pubs. And then a few days later, they said all clubs, pubs must close. And then a few days later, they said, right, we're going into lockdown. And then a few days later, they said, right, no, all non-essential shops should close and everybody must stay at home unless they're doing an essential service. So it's a gradual progression towards lockdown. So that's probably why the difference between before lockdown and after lockdown is a lot smaller than perhaps the other countries. The cases per million before lockdown was 110.8. That's increased to 562. A net slowdown of cases of -8%. A net increase of cases 451.2. So before lockdown, cases were doubling once every 4 days. After lockdown, they were doubling every 7 days. And in terms of lockdown timing, in terms of cases, the rate of increase was too slow, but the number of cases was too many. So they got it about right in terms of cases. In terms of deaths, so the death rate before the lockdown was 30%. That's now dropped to 24% per day. The number of deaths was 5.95. Today, that's 64 per million. So that's a decrease in the death rate of 6% and an increase in deaths of 58.05. Now, at this point, the UK was doing actually pretty well in terms of our list and was actually top of our list. But when I get to the next slide, you'll discover why the UK is in 8th position. The deaths before the lockdown were doubling once every 3 days. Deaths after the lockdown were doubling once every 4 days. And then we get onto the lockdown timing in terms of deaths. Death rate was too fast and the deaths themselves were too many, which implies that the UK had a lot more cases than we were discovering. Otherwise, we wouldn't have had so many deaths. But there's also another factor to this, which is that in the UK, we test people if they're in intensive care, and we had a lot of older people that initially got the virus. Whereas in Germany, for example, we've been told that the original cases came from the Italian Alps, which were a demographic much younger, and they've been doing more extensive testing anyway. So let's have a look. So our testing position is 10th, so not the worst on our list, but still pretty low. Tests per million, 2,698. Hospitalised ventilators per 100,000, 10.1. Beds per 100,000, 2.54. And approval rating, Boris Johnson doing very well, 61%. And our mobility is down pretty much in line with Europe, down 50%. In 7th place is Canada and Justin Trudeau. So they went into lockdown on the 17th of March. Cases before the lockdown were increasing at a rate of 33%. After lockdown, it's now 16%. Cases per million before lockdown was 17.4, now it's 328. So that's a net slowdown of 17% and a net increase of 310.6. The cases doubling before lockdown was once every 3 days. Now it's doubling once every 6 days. And they got the timing of the lockdown in terms of cases about right. So the deaths were increasing at a whopping rate of 67% per day before the lockdown. That's now decreased to 24%. Deaths per million before was 0.23. Now it's 6. And that means a net death rate change of -43%, which is quite big, and a total net deaths change of 5.77. So deaths were doubling before lockdown once every 2 days. Now they're doubling once every 4 days. Deviation from the lockdown rate was too fast, and deviation from the lockdown deaths was too few. So they got it about right in terms of the timing of the lockdown. Approval rating for Justin Trudeau is 49%. Hospital beds per 100,000 is 2.52. We don't know the number of ventilators that they have. And testing per million is 8,021. So testing-wise, they're doing pretty well in 5th position. Hospital-wise, because we don't know the number of ventilators, pretty poorly. And mobility isn't that far down, actually. Only 34% down. In 6th place is Australia and Scott Morrison. So Australia went into lockdown on the 30th of March. Before the lockdown, cases were increasing at a rate of 12%. That's decreased to just 8%. Cases per million were 176.3. and now they're 210. So a net change, a net slowdown of just 4%, a net increase of 33.7. So cases were doubling once every 9 days, now they're doubling once every 13 days, and the rate of increase before the lockdown was too slow, but the number of cases was too many, so they got it about right in terms of cases. And in terms of deaths, so 16% increase per day. Before lockdown, it's now 12%. 0.68 before lockdown, it's now 1. So a net change of minus 4%, and net increase in deaths of 0.32. So not really that huge, actually. That's probably because Australia is quite sparsely populated in terms of the population density. So deaths were doubling before the lockdown every 6 days, now they're doubling every 8 days. And in terms of deaths, actually, the lockdown was too early because the rate of increase was too slow and the number of cases was too few. And mobility is not hugely down either, minus 30%, approval rating about average 57%, hospital ventilators per 100,000, 5.4, hospital beds per 100,000, 3.84, tests per million, at the best position on our list, 11,203. So this is why they're in 6th position, really. It's because their hospitals aren't terrible and because they're doing a lot of testing. In 5th place is Italy. So Italy, before getting the virus, cases were increasing at a rate of 22% per day. And I feel for Italy because their outbreak was kind of taken by surprise by them. One 38-year-old man spread the virus around Lombardy, and of course that was unknown that he had the disease until it was too late, in which case they had a huge influx of cases around Lombardy, and they had to go into lockdown on the 10th of March. Cases per million before lockdown was 174.5 because, again, they were taken by surprise. Cases per million after was 1,982. So they managed to slow down the rate of cases per day by 17%, and they've increased the number of cases by 1,807.5 per million. But for a country that has the second most number of cases in the world right now, to get 5th position on this list is a testament to the healthcare workers and the government and the people that work in Italy at the moment. Cases before the lockdown were doubling once every 5 days, and now they're doubling once every 20 days. In terms of the lockdown timing, in terms of cases, the rate of increase was apparently too slow, and the number of cases was too few compared to the average, which implies that the number of cases that they actually had and the number of cases that they recorded was a lot less. In terms of deaths, so deaths were increasing at a rate of 35% before the lockdown. In the last 7 days, that's slowed down to 7%. Deaths before the lockdown were 10.44. Now, per million, after the lockdown, they're 243. So a net slowdown in deaths of 28% and a net increase of deaths of 232.56. So deaths before the lockdown were doubling once every 3 days. Now they're doubling once every 15 days. So just over 2 weeks, which is quite a good slowdown. They got the lockdown timing in terms of deaths a little bit late, actually, which again implies that the number of cases that they actually had and the number of cases that they recorded was vastly different. And of course, that meant that they were too late with their lockdown. So mobility isn't actually down hugely. It's down just 30%. Approval rating of Giuseppe Conte, 51%. Ventilators per 100,000, 8.3, which is quite good. Beds per 100,000, 3.18. And tests, again, one of the best countries in the world to test, 10,252. That's probably because they've had the most cases, though. So doing pretty well in terms of hospitals and testing, which is probably why they're 5th on our list. So in 4th place is South Korea. So South Korea, before the lockdown, they went into lockdown way back on the 21st of February. Before the lockdown, they were increasing at a rate of 46%, and because they've passed their peak, now they're increasing per day at just 1%. So that's a massive, massive improvement. Cases per million before were 4.1, now they're 196. So a slowdown of 45% and an increase of 191.9%. 0.9. So cases before the lockdown were doubling once every 2 days, and now it's once every 89 days, which just proves that if you stay at home, you can protect the NHS or protect your health service, whichever country you're in, and you can save lives. And it will, every country should hopefully follow the same path as South Korea and slow down just as they have. In terms of that actual lockdown timing, they got it about right. So the number of cases was actually too few, but the rate of increase of cases was actually too fast. Again, it's important that countries look at the rate of increases rather than the number of cases, because I find that if you look at the number of cases, it's probably already too late. Deaths before the lockdown were 17%, now they're just 3%, and they were 0.03 deaths per million, and now they're 3 deaths per million. So that's a net slowdown of 13% and a net change or increase of 2.97 per million. Deaths were doubling before the lockdown once every 6 days, now they're doubling once every 31 days and once every month. In terms of deaths, there was actually too little per day and too few overall as this country went into lockdown. So they actually went into lockdown a little bit too early, but as we've seen from the graphs, it helped. I think mobility has actually increased because they're starting to be more mobile now because they don't need the lockdown measures. Approval rating is 44%. Hospital beds in a great position, 12.27. Ventilators, 19.1. And test 8,875. Again, good at hospital position, good at the testing position. Mobility can now start to be loosened off because they've passed the peak. So well done, South Korea. Now our third place you're probably not going to like, but our third place is Russia. So before the lockdown, they went into lockdown officially on the 28th of March. Now their data might be completely falsified, but we can only speculate based on data. They went into lockdown on the 28th of March. Rate of increase beforehand was 23%, now it's 22%. Deaths per million beforehand was 8.6, now it's 28. So a net slowdown of just 1% actually, and a net increase of cases of 19.4. So cases beforehand were doubling once every 4 days, now it's once every 5 days. And they went into lockdown actually early, according to the cases that were recorded. So the rate of increase was too slow and the number of cases was too few. Death rate increased beforehand at 39%. That's actually increased to 47% in the last 7 days. So that's 0.04 deaths per million beforehand and 0.3 deaths per million now. A net change or increase in rate of death of 8% and a net deaths change of 0.26. So deaths were doubling before lockdown once every 3 days. Now that's once every 2 days. And in terms of deaths, in terms of rate, it was too fast. In terms of lockdown, it was too few. So they got the timing about right in terms of deaths for lockdown timing. Approval rating of Vladimir Putin, unsurprisingly, because it's probably falsified, is 69%. Mobility is unknown. Beds per 100,000, 8.5. That's pretty good. Ventilators per 100,000, 27.3. Again, amazing. And tests per million, 4,379. So 7th in our testing position. So who's going to be 2 and who's going to be 1? Probably you already guessed by now, but let me just reveal who's in second place. It's France. So France went into lockdown on the 16th of March. The rate of cases before the lockdown was 24%, and now it's just 10%. The cases per million before lockdown was 110.7. Now it's 986. So a net slowdown of cases of 14% and a net increase of cases of 875.3. So cases before the lockdown were doubling once every 4 days. Now it's doubling once every 10 days. And in terms of the deviation from the lockdown rate, they got it just right. And in terms of the number of cases, there are actually too few cases. So they got the science of the lockdown timing in terms of cases pretty much spot on. The death rate before the lockdown was 29%, now it's 19%. Deaths per million before the lockdown was 2.27, and now it's 100. So they've managed to slow their death rate down by 10%, and the number of deaths has increased by 97.73 per million. So to put that in perspective, so deaths were doubling once every 3 days, now they're doubling once every 5 days. So the deviation from the lockdown rate was 1% too fast and the deviation from the lockdown deaths was 0.57 cases per million too many. So they pretty much got it bang on when it came to their lockdown timing. And the public have been complying, so 61% less mobility. Approval rating for Emmanuel Macron of 35%. Hospital beds per 100,000, 5.98. Ventilators per 100,000, 44.8. Pretty good in terms of hospital position, so that's second overall in terms of the world. Tests per million, 3,436. Pretty poor in terms of testing though. So overall, in terms of basic stats, they've done pretty top in all except perhaps testing. So, who's going to be in our number one spot? You probably would have guessed it by now. So our number one is Germany. So, Germany, they went into lockdown on the 16th of March. Again, the same time as France. So that 16th of March date seems to have been quite a good time for other countries that weren't Italy to go into a lockdown. Cases rate before lockdown was 29%. Now it's just 9%. Cases per million before was 93.1. Now it's 1,086. So a net slowdown of 20% and a net increase 992.9. Cases were doubling before the lockdown once every 3 days. Now it's slowed down once every 11 days. So a deviation from the lockdown rate was too fast, and a deviation from the lockdown cases was too many. The death rate increases before the lockdown was 45%, it's pretty high, and the death rate increases after lockdown was 20%. Deaths per million before lockdown was 0.2, deaths per million after was 15. So net slowdown in deaths of 25% per day, and a net deaths change of 14.8. So deaths were doubling beforehand once every 2 days, now they're doubling once every 5 days. So death rate in terms of their lockdown was too fast, but the number of deaths was too few. So again, they got it pretty much spot on. Again, I'd say maybe their death rate was maybe a bit too fast. In terms of the rest of our countries, it's not too bad at all. So the approval rating for Angela Merkel is 49%. Mobility in Germany is down 46%. Hospital beds per 100,000 is 8. Ventilators per 100,000, amazing, 30.1. And tests per million, again, the best in the world, or the second best in the world, behind Australia, 10,962, which is where they're first on our list, really, is because they've got the factories and they've got the testing capability, because they've got the industry, basically, already set up in their country. And as a result, they've got the economy to support the hospitals, and their hospitals are very good. So that was our list. Do you agree with the rankings I've put them in based on the data? And which of the countries in lockdown do you think is going to be out of lockdown first? Join in the debate below and subscribe.